If you're joining remotely, please mute yourself and turn off your mic. Hello, cuckoo, Mike, Mike.
The naughty steps over there.
Please mute yourself, Mike, and turn off your camera until you're invited to speak. Only commissioners joining remotely will be invited to speak, and when you finish speaking, turn the microphone and the camera off again. Don't use the meeting's chat. Commissioners in the room, please raise your hand, turn the microphone on, and you'll be asked to vote by raising your hand. Only those in the room can vote, and you can only speak once during the debate. Please remember to turn your microphones off again. Those who join in the room and in Teams, please mute your speakers, and can everybody remind us who they are before speaking with your names, those in the room and those joining remotely. And I think we're going to go straight into going live.
So the meeting is now live and is being broadcast and recorded.
Thank you very much. So welcome everybody to this session of the Overview and Scrutiny meeting. We have apologies from Councillor Barnard, Ebele and Mackenzie Boyle. Are there any others?
No other apologies, Chair.
Minutes of the previous meeting, agenda item 2. I was late to the last meeting on the 3rd of July, so I've been asked to ensure procedural integrity and sign off for the minutes from the meeting on the 5th of June to be confirmed again. So were there any comments on the minutes from the 3rd of July? No, okay. So I move that those minutes are accepted and request a seconder. Thank you, Jodie. We'd like to welcome Councillor Wright, the executive. Oh, sorry, no. If any amendments are requested, we'll accept the amendment, but we're not doing that. Agenda item 3, declarations of interest. Anyone working under the party whip that they wish to declare. Agenda item 4, urgent items of business.
There are no urgent items of business, Chair.
And agenda item 5, have we received any requests under the public participation scheme?
No requests were made.
So we now move to agenda item 6, which is the council plan overview report, which might be referred to as the CPOR. And we'd like to welcome the Chief Executive, Susan Hallowell, who's going to present the CPOR, and then we'll move on to some questions. Thank you.
Lovely. Thank you very much, Chair, and good evening, everyone. We are presenting this evening to you an amended version of the the council plan overview report. As we've mentioned in previous meetings, we've transitioned to a new approach. We've moved away from a historical software, and we're now using a new approach to present the information. So hopefully you will find the report more accessible, more readable, and more consumable in terms of understanding our performance against the targets and the actions that we've committed to undertake, and also the trend, so whether things are looking up or going in the wrong direction. So hopefully I'll be really interested to hear your views on how it's presented. Hopefully you do just that, find it more accessible, but this is an improvement process. So this is the first report, so if there are any improvements that we can make, please do share those, because we're keen to make sure that this continues to evolve. In terms of the key headlines, I think we've got a solid start to Q1, particularly against the actions delivered. We've got some key highlights, and you'll note from how the information is presented, 100% of our actions are green for our green and sustainable environment priority. I think a few more priority actions are read within the resilient and sustainable organisation. And I think that really reflects the state that generally that we find local government in terms of the challenges around adults and children's, and that's reflected in the challenges that we're looking at in Q1, which is a complexity of cases within adults and children's, and that undoubtedly has an impact on our budget. So whilst we are reporting a much better position for Q1 than we did last year, this time last year, if you recall the significant overspend that we were forecasting due to emerging issues, we do have a slight overspend that we're forecasting, and the majority of that is in relation to people services. So it is around the complexity of cases. That said, we're managing it very closely and keeping a very close eye on the interventions that we can undertake to make sure that we come in against budget. So I think, Chair, if I am able to leave it there, I'm very happy to answer any questions.
Thank you very much. So we'll open up to questions. Councillor Haverty.
Thank you. The new report format looks really good. It's really good to see the trends. Appreciate that. It's nice. In the highlights page, you mentioned the new magazine we've got, Your Bracknell Forest, that has been sent out to all residents. Now, I didn't receive it, and other people I've spoken to haven't received it, and I believe there's probably people here that haven't received it as well. And yet for some people, this is pretty much the one way that they actually see what we're doing and what we're getting up to. And I was wondering if there's a way you could sort of do a sort of snapshot survey or something and get an idea of what that distribution was for that last one, and see if there are any significant gaps in learning that we can use for next time for that.
Thank you. Yes, I have received informal feedback that a number of councillors didn't receive it. We did undertake some informal assessment as to who, mainly through staff across the borough, as to whether they've received we call it a magazine, it actually looks like a newspaper, and they all confirmed that they received it in April. So we have had a conversation with the distributor. I haven't had an update as to where we've got to with that conversation. You're absolutely right. If it's going out once a year, we want to make sure that everybody does receive it. We're also really mindful that some people will have no junk mail stickers on their letterboxes, which will mean they won't receive it. So we need to be mindful of those issues as well. So I'm grateful of your feedback, and we will use that to inform how we approach the distribution company as well.
Any other questions? Go again.
Okay, me again. By the biodiversity SPD, in the green and sustainable action, you mentioned that the biodiversity net gain SPD will no longer be produced, and instead it will be widened to a more generic biodiversity SPD. I know you've got some text in the report about this, and it sounds like a good thing. I don't know if you're able to give more comments on this now, or would we be able to get some sort of briefing to understand the thoughts behind this and the scope of the new broader SPD?
Yeah, absolutely. We could do a briefing note for you if that's helpful for the Commission, so that, yeah, we can do that, definitely.
Anything else? Anybody? Councillor Gosden.
Thank you. Firstly, I want to also concur that the report was a lot easier to read, and especially you could sort of focus on what you were actually sort of looking for on this, so thank you for that. The ones that are actually in red at the moment, where it says it's worse, how far are we to actually sort of improving that and bringing them up to amber at the moment?
It will be dependent on each action. So do you have a specific one that you were thinking of?
Yes, I was thinking in particular of the completion of the new homes in line with the housing trajectory. Please.
Okay.
Thank you.
Yeah, okay, that's a really good example. So we will have forecast a trajectory in the local plan as to what we think we should be delivering and what our target should be for each year. That, though, is dependent on developers coming forward with planning applications. So it's not something that we can necessarily influence in terms of improving it. However, if the market picks up, then it will improve. In this quarter, it's obviously down. That doesn't mean to say it won't then improve and be closer to amber, but at this stage, it's looking like we're not going to be delivering on the target within this year.
Any other questions from the commissioners? I'll agree that I think the new layout is really easy to digest, much clearer, much better presented, and yeah, I found it a lot easier to digest, and the trends as well really helpful. Sort of honing in on one of those that is both red and trending worse is the percentage of care leavers not in education or training, which has gone up. Not a huge amount, but it's going up. How's that being addressed, and do you see that as something that's going to continue to go up by more significant percentages?
Excuse me. So that's a good example where later on below the table, we pull out specific narrative in this report on the performance indicators that are red, and we give you a little bit more information. So on page 35 of the report, I think 49 of the pack that you're looking at, there's a table there with 1.21 which gives you further narrative around the individuals not in employment or education, and some information around what we're doing about it. So hopefully when you're looking at this report, when you do have those reds coming out and the position is worsening, we've got that narrative for you ahead of reviewing the tables.
So you feel that it's something that's being addressed, for example, appropriately, it's captured here, and
yeah, oh yes, yeah, absolutely, yeah, sorry.
Okay, thank you very much. We can move into debate if there's no further questions. Would anybody like to say something further at this point? Councillor Hafferty.
Thanks. Yeah, so it's about the biodiversity SPD. I think it's good, and I think it would be nice if we could ask for a briefing notes relating to that. So the new biodiversity SPD. Thanks.
Okay. Anybody else? No? Okay. Well, I'm happy to second that recommendation. Shall we take a vote on that? So we can pass that recommendation.
Okay, so that recommendation is going forward to provide a briefing note regarding the biodiversity aspect. SPD.
And the recommendations agreed, or this recommendation, will be reported to the Cabinet this month. Thank you very much, Chief Executive, for the update. So agenda item 7, we have the standard Cabinet member portfolio update, and we've got Councillor Wright, who's our Executive Member for Adults and Public Health. He'll be joining us momentarily.
Hello, thank you for the opportunity. Thank you.
Hold on, we're just having a technical error, which will give a few seconds to try and iron out. But in the meantime, thank you for providing the written update, Councillor Wright. And we're going to look at some slides in a moment. Perhaps. Do all commissioners have the slides open? Because if we've got them, we can, Councillor Wright can start, and then if we can get it on the screen, then we, great. Okay, anyone have an issue with that? No. So, Councillor Wright, thank you for your slides, and we will go through it on our screens here. So, thank you very much.
Okay, thank you very much. Yes, so my name is Councillor Megan Wright, and I'm the portfolio holder for adult social care and public health. And this is just an overview of what's been happening over the past year. So if we go on to the second slide, so some key activities. We're currently just in the process of completing the Bridgewell facility at Birch Hill, which is going to offer enhanced living for people living with learning disabilities. This will start moving people in there from October, and it will be hopefully filled by Christmas. So that's what's happening there. Obviously, that will free up some houses, which we've yet to decide what to do with them, whether or not we return to landlords or repurpose them for general use. And then we've got our new model for support for learning disability and autism. So we've got something called the Supported Living Framework, which is for people with learning disabilities or autism that are living in council contracted houses, and how do we support them? Because previously we had quite a blanket provision, but now we're looking at a better, more tailored level of support for these people, which looks at having a core staff that support them, and then flexible kind of and more tailored activities during the day. So that's been a change in our framework. And then we also, so that's our supported living framework, but then we also have our home care framework. So this is for people with learning disabilities and autism who are maybe living independently but need additional help. They might be living with their parents or a carer and need additional help. And we've also changed how we support those people with a better, more tailored approach. And then if we move on to, we've been involved in quite a lot of refreshing of strategic plans, new strategic plans. You'll know that we brought in our new carer strategy, which obviously was a huge project. It involved consultation with over, I think it was 1,000 people who were unpaid carers in the consultation. And then we developed a carer strategy, and now we're in the implementation process for that. We've also improved our intermediate care service, so that's for people who have been discharged from hospital, and how we support them to become independent and live independently post discharge from hospital. And within that as well, we might actually do earlier intervention to prevent those people going to hospital. So that's an improvement of our intermediate care service. We've also restructured our adult social care. We've gone down to one director post, And then the other things that we've done is re-procurement of some contracts, and then also we also had to respond to the closure of Nottingham Rehabilitation Services, which was one of the main providers of equipment. And it was a provider for quite a large proportion of the country, and it went into I don't know if receivership, but it was showing that it was struggling financially. But we had a very good response from within Berkshire and managed to set up a backup service which seems to be working well. So a really good example of working with other boroughs to respond to an emerging risk. And then, I'll just move on to slide number 3. Have I talked about that? Yes, I've talked about intermediate care. So we're currently working on our dementia strategy and also our autism strategy. We currently support 420 families with dementia. We know there are about 1,100 families living with dementia in the borough. Of those, 420 are drawing on care from the authorities, and the others we're aware of, and we might be offering less direct support, such as cafes and things like that. So that's our dementia, our current dementia offer, but we're working on doing a refresh of the dementia strategy. And then the Bracknell Forest Community Network. So this is our mental health support, and we're seeing a real improvement, increase in referrals, and lots of people receiving one-to-one support. But we also have some great group activities, and lots of you will be aware of things like the Happiness Hub and the Community Mental Health Team. So we've got some really good offers for people at different stages of coping with mental health issues. I think that's, and then just on that, with regards to sort of staffing, you'll see that on the adult care team we talk about 3 newly qualified social workers have completed their ASYE, which stands for Assessed and Supported Year in Employment, and taken up permanent roles. We're using quite a lot of initiatives to deal with the challenge of maintaining a strong, well-qualified workforce, and we're seeing the results of that now. Things like golden hellos, referring a friend to come and work in the organisation. So that seems to be working quite well. I mean, staffing will always be a challenge, but we seem to be have some good strategies there to deal with that. Okay, I think that's everything on slide 3. If we go on to slide 4, so there's more about staffing there. Hightown is going to be working as the Bridgewell provider. Autism sessions, drop-in sessions. We would. Sorry, let me just look at my notes because I remember talking about this with. Oh yeah. So sorry. So I'll talk about that in the next slide. Okay, forest care. That's going well. As people who don't know what forest care is, it's an emergency out-of-hours service. It's Bracknell Forest. It provides 24-hour service with the pendants and various alarms and other various assisted technology. And then we also have contracts with other local authorities to provide out-of-hours service. This is an opportunity for us to generate some income and also to provide a good service. And we're looking at how we can improve that offer to a wider audience. And then I think that's it on forest care. And then if we just look at our next steps. So this is slide number 5. Supporting individuals to move into Bridgewell, we've talked about that. Support providers with ongoing service improvement and social right. Sorry, I haven't really talked about our CQC inspection. I don't know if I've seen you guys since our CQC inspection. We had a CQC inspection, the results came out last summer, and we came back as good. And obviously there were a few things that we need to follow up on, and we're working on that now. And then that's the slides. I just wanted to highlight some other things. So we're working on the dementia strategy, working on the autism strategy. We also, some of you will be aware, we've got the all-age exploitation strategy that's out for public consultation. And then you'll also know about our financial inclusion activities and our work through the welfare service. And then in the future, we're looking, so this is in the near future, digital transition of our intermediate care and our support that we offer at Waymead, which is our support for people, resident overnight support for people with profound disabilities so that their families and carers can have a break. And then we're also looking at transition, so that's young people transitioning from children's services into adult services, and how can we make that more smooth, how can we improve it for everyone, so that they gain independence but safely. So we're looking at a multi-agency strategy for that. Okay, so that's adult social care. There is overlap between adult social care and public health, but I don't know if any of you have got any questions on that before I move on to public health, or I can take them all. Yeah.
Yes, let's take questions for these and then we can
Yeah.
move on to public health. Councillor Forster.
The forest care move from analogue to digital, there's been a lot of press and a lot of people are worried, obviously, with the resilience of the solutions. The loss of power means the loss of the digital infrastructure. Are you confident that we've got the necessary technical solution and confidence building measures for users of the service as we hopefully go through this particular transition?
Thank you. It's a good question. We've done a lot of work on this. There's been a lot of work on looking at people's equipment, updating equipment. A lot, I would say, since I've been elected, all the equipment we're giving out is suitable for digital. It's not analog. So yes, I'm relatively confident, and I think we've also got the safeguards in place for if there are technical hitches when things change over. I don't know. Yeah. Yes, we've discussed it, and I've had assurances from the forest care team and the out of hours team. So that's Tony Dwyer, who's director of adult services, and Hannah Doherty, who's the service manager of that. And we've done lots of work to prepare for it. Yeah.
Councillor McLean, then Councillor Watts.
Thank you for your presentation. You touched on the perennial difficulty of young people transitioning to adult social care. Could you perhaps elaborate on what practical steps are being taken or will be taken to ensure that no one falls through the cracks and there is a seamless service between children's and adult social care? Thank you.
Thank you. Thanks for the question. So I'll give you a few practical or two I've got here. Travel training. So for people, young people with learning disabilities who are transitioning, they might need help with kind of that more independence, actually providing travel training. And then we've also got a drop-in centre for people to be helped with filling in forms and all those things that you have to do as you become an adult, you know. So we've got, so they're two practical examples of how we're helping people with a transition from into adulthood. I'm sure I could try and think of some more, but they're some of them. And I think we have commissioned some, we'll have a new member of staff who's specifically focused on this. And I think the plan is to try and work earlier with children and stay with them for longer, just to make sure that they're as independent as they can possibly be.
Councillor Watts.
Hi, I wanted to comment on I'm very pleased to see all of these, particularly the autism services, because obviously we have many autistic and SEND children in our area who are going to be needing that as they grow. Just on forest care, how do you spread awareness about what forest care provides, and how are you getting consultations out to the public, please?
There's information on our website. If anyone was to phone our adult social care sort of front door number, you know, we've got this new operating model where there's no wrong front door. You know, whoever you call, you will get supported. So that might be a way they'll be referred. We have a demonstration centre where people can go and try out the equipment. So if they're looking for assistive technology, they can go and have a look at some samples and give things a go. But you're right. Maybe we could do a little bit more to let people know what's available. I mean, I mean, we do a lot. There's a lot of information, and all the social workers will be aware of what's available. Adults, so they're. But yeah, okay.
Okay, it's a question about community mental health, and obviously the Bridgewell Centre is opening. I presume that's for vulnerable adults. Is that for adults that have mental health problems, or is it, can you hear me? Mental health problems, or is it people, adults with ASD? Because there's a distinction between people with severe mental health and ASD. That's the first question. Secondly, if it is for vulnerable adults who have learning difficulties, do we have facilities still for supported living for people who have severe mental health problems in the borough? Do we have sufficient homes for those? Thank you.
Thank you for the question. So the Bridgewell facility is for adults living with learning difficulties and autism, so not necessarily mental health issues. These people are previously already in supported accommodation dotted around the borough, and the plan is to bring them into these 4 self-contained sort of tailor-made flats for them. So that's our provision for people with learning difficulties, and obviously there'll be, you know, that's a continuum. There'll be other people who are supported in the community, other people who are living with their families and need extra care, etc. So that's supporting people with severe learning difficulties. With regards to mental health, a lot of the support will be in the community, but if it's severe mental health, then they'd be under Berkshire Health Foundation Trust, so they'd be managed by the NHS. But what we're trying to do is we're trying to help people in the community with various services like the Happiness Hub and various social prescribing, all of these kind of earlier interventions to kind of help stabilise people before they have a severe mental health crisis and make sure that they're getting the right treatment. But our mental health services for people with severe mental health would be through the NHS. Thank you. Thanks.
Could you give a bit more detail about the Happiness Hub? Because it's not something I know much about.
Okay, so I mean it's a service that sort of moves around the borough. So it's 1 week it's like a drop-in cafe. So there's lots of activities to do. There's qualified mental health workers, but it's also just generally to kind of support people. So you know there might be. I mean I've been and I was doing colouring, but also there's that opportunity to talk to people for support, find out what else is available. And I know from the Happiness Hub that I've been to the Happiness Hub, and then I've seen people from the Happiness Hub on doing the walks for wellbeing. So it's that trying to help people kind of look at ways of coping with their mental health problems within the community, you know, and so that combination of having a Happiness Hub, social prescribing, other activities that are available in the community, just to, you know, help people find what supports them at an earlier stage. So I mean it's a great service, but it's almost just like a drop-in cafe. There's one at the fire station in Crowthorne. I've been to that one. There's one in the Brew Cafe in East Hampstead on Thursdays, and very inclusive, wonderful kind of welcoming atmosphere. So great for someone who's struggling a bit socially or struggling with depression or anxiety. So it's very supportive. Thank you.
Great to hear. Is it new?
No, it's been around. It's been around since I've been elected, and I think it must be relatively new because the numbers are increasing. I think that they've managed to they've built their reputation, and they've branched out a bit more to different areas. So yeah, it's good.
Thank you. Any other questions?
You also mentioned in passing about staff recruitment and retention, which has always been an issue as long as I've been involved in Bracknell Forest, given that geographically we're very close to 5 other unitary authorities surrounded by counties and very close to London, which means that the pull potentially of other authorities to recruit our staff is quite a challenge. Where are we with recruitment and retention, and are you satisfied that the council's in a good place to encourage staff to join and stay?
I think the initiatives I talked about earlier, the Golden Hello and then the Recommend a Friend, they're relatively new, so we've yet to see how successful they're going to be, but these are new initiatives. The other thing I didn't mention is social worker apprenticeships. So these might be people that have started working in the council, maybe as a social work assistant, and they've gone all the way through and got a degree and maybe got further qualifications, like the qualification where you can help. Anyway, there's extra additional qualifications, for example, provision of liberty status and sort of mental health within their social work qualifications. So we offer lots of in-house training, and that helps build loyalty and keep people here and see opportunities to grow within their work in the council. But you're right, it is a challenge, but we seem to be, our new strategies do seem to be working so far, so far we're okay. So I think.
What's more difficult, recruiting or retaining?
I think from what I've been discussing with Grania, who's director of people, it's a little bit of each. I mean, obviously we've got experience as a social worker is really important, and you want your experienced social workers to stay, and we are, and that's why we're offering that kind of scope within the organisation to grow within the organisation. I mean, I don't know if was Hannah mind me using her as an example. Probably just use the okay, yeah. So just so if someone might come in as an apprentice and they've got the scope right to move up to being a manager of a program, manager of a service, and we have seen that in some of our teams. So I think that's a really good way of kind of keeping people on board, seeing the opportunities within the organisation to grow. But yeah, it will always be a challenge, I think.
Any more questions for Councillor Wright? No, okay. Well, thank you very much.
I've got public health. Do you want me to move on to public
yes, we're going to move on to public health, indeed.
Right.
So your next set of slides.
Okay. Where am I? Are they not up there?
No, I haven't got these on my pack.
Right. Yeah. Okay. I've got my notes on my computer. So anyway, so slide 7. Obviously, there's a little bit of overlap here between what we're doing in adult social care and what we're doing in public health. So public health team supported the adult social care team with the dementia needs assessment. Community profiles. So let me just get my notes up, sorry. So community profiles and engagement. This is about looking at your community and looking at those hard to reach communities and actually trying to understand them a bit more and how can you engage with them. So for example, we've run the World Cafe events at the Open Learning Centre, where we've had separate ones for people coming from Hong Kong, Nepali, Romanian, Polish, and Indian communities. So we've got that. We're bringing strategies to make sure that we're engaging everyone in Bracknell Forest, and especially when it comes to public health. And actually, we had a World Cafe downstairs here in the council, in a cafe which was with the Indian community, which is, you know, a really interesting time to get everyone from the Indian community together, but also talk to them about health issues that might specifically affect their you know, culturally. People from the Indian subcontinent quite often have high blood pressure, and so talking to them about getting their blood pressure checked and how they can do that. Work with the Hong Kong community was quite interesting, because they said that one of their problems is that they're not used to having, this is what they were telling me, that they're not used to having choice. So they go to the doctor and the doctor say, you could do this or you could do that. And that they would normally expect to be told what to be done. So some of the people within the Hong Kong community were working with other people within the Hong Kong community about how to access services and how to sort of investigate choices. So we've done a lot of community engagement work. Right, and then SEND needs assessment. So obviously we all know that special educational needs and disability is a real hot potato for councils, and the health element of that, we're doing a deep dive into what's going on there. So for example, your occupational health, your speech and language therapy, and it will be, the results of this will be published as part of the SEND improvement plan. So that's something Public Health are working on. And then equality, diversion, inclusion. So this is us moving from a sort of equality screening to an integrated impact assessment tool. So this is any new intervention we do, any current intervention we're doing, it's not just looking at equalities, it's also looking at, is it having impact? And is it, you know, what's the wider impact of that? So that's introduction of a new tool that's come in, and that's but it's not just with regards to health and well-being. It's also equalities, but it's also climate change and sustainability. So is this new intervention actually a sustainable one that's not going to cause too much environmental damage? So that's that, and then and then progress within the public health work plan. The community map, lots of you will be aware of the community map. It's a fantastic resource for people to, online, for people to see what services are available in the borough. It's an interactive map where you can type in what you're interested in, and it will take you to the, show you what's available. And then making every contact count. This is an NHS initiative which was very successful within the NHS. It's been rolled out to councils, and we can all do it. I don't know if any of you have done it in your day jobs, but it's all about making every contact count. So when you're talking to a resident, are you using it as an opportunity to talk to them about their health, smoking, their mental health, and then what do you do with that information? What can you say to them? How can you help them? So it's a simple course that we're rolling out across the council, and if people are interested, I'm sure you can. Well, if you ask me, I'll send you the link of who's doing the training of it. It's a simple one. And then stopping smoking services and support. So we're doing some more targeted intervention, so people living with mental health problems or drug and addiction problems. Also, pregnant women. The other thing that we're doing is we're now having a lung cancer screening facility that so that's part of the NHS, but when that comes to visit here and people come for lung cancer screening, they can also access stopping smoking services. So it's synchronising those two services. If we go on to the next slide. Okay, so our areas of focus for 25-26. Our joint strategic needs assessment. So this is something which is a tool that looks at what's available in the whole of the borough with regards to health and well-being and health and care and well-being. That's undergoing a refresh, and we're working with the LGA, who are kind of looking at what we're currently providing, how well all the different organisations are talking to each other, so the NHS, the council, voluntary sector, police, fire service, all those things that, you know, wrap around someone to make them healthy and safe. And then and that ties into the next one, the Joint Health and Wellbeing Board strategy. And then you've got your pharmaceutical needs assessment, which is something that the Health and Wellbeing Board has to publish every 5 years, looking at, are we meeting our pharmacy needs across the borough? And that's been a project we've been working on, and that gets published in autumn. And then priorities within the public health work plan, whole system approach to healthy weight. We did an evaluation of our current programme, and it wasn't having the impact we hoped for. It wasn't good value for money. So this is with adults. So we're looking at a new model. Sorry, excuse me, it's on my thingy. It's using an app that's come recommended, and also face-to-face work. So that's a new weight management programme we're hoping to introduce. Sorry. I should have brought my glasses. I can't. And then Healthy Workplace Alliance. This is a great initiative. This is working with local businesses to make sure that their workplaces are as healthy as they can be. It's looking at everything. Again, the making every contact count. We're offering that training to people within organisations so that they can support everyone in their mental health and well-being. So it's looking at health and well-being in workplaces, and how can we make workplaces as healthy as possible? What can we do to support them? And then our mandated and non-mandated services. So public health provides sexual health services, so sexual and reproductive health services. We're just in the process of commissioning our new service, which the health and care overview and scrutiny plan will be very well aware of. That's out to tender at the moment. Stopping smoking services, I was just mentioning that about priority groups. Our 0 to 19 years public health nursing service, that's meeting the majority of key performance indicators. And then our NHS health checks, the uptake of these we probably need to improve, so we're looking at comms to raise awareness of their availability. And then system transformation, increasing our evidence-based practice within Bracknell Forest Council across the wider system. We've got some funding from the Institute of Public Health Research to sort of make sure that we've embedded research-based best practice within the borough. Are we doing what is shown to be the best interventions to improve public health? We also, it's not on the slides here, but we've actually got a really good public health dashboard now with really good up-to-date figures, easy to use. You can drill down to ward. I'm not entirely sure actually, but I think in some things you can drill down to ward figures of various kind of things like immunisation uptake, people with learning disabilities, employment. So all those sort of wider determinants of health are within this dashboard, and you can get a really good picture of how the borough's looking. And population health management and neighbourhood health. So that's the dashboard, but also neighbourhood health is, we've got our Thriving Communities programme, which some of you will be aware of, looking at trying to improve health of certain communities. And neighbourhood health is something that's very much within the 10-year NHS plan, and how does the council fit into it? And we're kind of preempting that with our Thriving Communities programme and other work. Okay, I think that's it. Any questions on health?
Yes, you mentioned that you meet the majority of KPIs on the 0 to 19 public health nursing service. Which ones fall without that majority? What are the minority?
Okay, so this is something I requested feedback on. Health visitors first baby visits should be within 2 weeks, and we were only hitting about 76% of babies being seen within 2 weeks. So I asked for some more feedback on that, and what it turns out is that actually quite often those babies are in hospital, so we don't get to see them because they're still in hospital, or so that was the majority of cases, and then the other ones were things like people cancelled. But then of those 24% that hadn't been seen within the first 2 weeks, it was something like a further 21% were seen within 3 weeks. So it was almost like they cancelled an appointment and saw them. So that was one area where I sort of challenged, why aren't we meeting our KPIs? I think I had a question submitted to me earlier about immunisations, and that was that you. And so just on immunisations, it's a national issue. There are lower uptake of immunisations, and Charlotte Pavitt, the Director of Public Health, has shared with me the strategy that we're using to deal with that. So there'd be a couple of examples, but overall, we've got very good early years health visiting, 0 to 19 health interventions. Thank you.
On that, so the immunisations is an area where we've missing a KPI, and is that a new trend?
Not since I've been elected. We've always been lower than what the target is, but we've always been higher than our neighbouring boroughs, if that makes sense. So I've got the figures in front of me. Let's have a look here. Yeah, so our figures are relatively good, but the let me just see if I can get it up a bit better. So, for example, we're fine on our 12. So, looking at 12 months immunisations. So the triple, what's it called, DPT, that we're fine, we're green. Our 12-month PCV and PCV2, so that's what's PCV? Can't remember. Yeah, that's the MMR. Yeah, so 12-month uptake, again, we're in the green, we're better than national averages. And then 12-month rotavirus, we're slightly below the guidelines. So, but then if you look at what's happening nationally, this is a national problem. But that doesn't mean that we're not taking it seriously. And Frimley ICB, who we sit under, have got a strategy for dealing with the immunisations. Yeah. Okay. Thank you.
You've got a follow up, Councillor Eggleston.
Yeah, thank you. So obviously they're going in for like the 6 week and the 12 week right up to a year. Is it the MMR that's the one that's bringing the figures down, but then they're going in for their preschool boosters? Or does it sort of, once they haven't gone in for their MMR, do they not go in for their preschool boosters then? Do you know at all? Because I think that's the one they're sort of, it's slipping down, and that's what's causing the problems and bringing the figure to less than 74%, which is affecting, the protection of all children, isn't it?
Is that a national figure you're quoting, the 74%, or a local figure?
No, that's national. You've got to have so many.
I just wanted to clarify. You're not talking about 74% in Bracknell.
No,
that's a national figure.
Yeah.
Yes.
Councillor Eggleston, can I get back to you on that? I'll find out. I'm not entirely sure. So I could. We have started some MMR catch-up clinics, which makes me think that maybe that is an issue. Maternal vaccination for each community. Yeah, so I'll find out for you, but looking at this, it looks like it's, for example, the latest available data shows that MMR uptake at age 5 for the second dose in Bracknell is 91.3%. England average is 84.3%, which is above the lower threshold, but below the 95% standard required for herd immunity. So sorry, the answer is there. Yeah. So yes, yeah, it looks like it's the age 5 that's a challenge, as our uptake is 91.3 and it should be 95%, but we're still higher than the England national average, which is 84%.
Thank you. And are we sort of working with Public Health England, the PCNs, etc., to be able to encourage parents to uptake for the ones that they're missing before the children start school?
Yeah, there's Frimley have got a Frimley vaccination strategy, which I'm more than happy to share with you after this. Yeah, they've the delivery of the strategy is overseen by the Frimley immunisation programme, and so they'll be the ones in charge of delivering it. But I'm more than happy to share that with you. And obviously, this comes up at our we get at the place meetings, so our quarterly place meetings, we get an update every quarter on vaccination uptakes, and so it is something that we monitor quite closely.
Thank you.
Councillor Presland.
Hi, just a quick question. So we've got flu season about to approach us. Are we ready for our residents? And I believe that most people are not getting the COVID jab, the dual jab this year. Do we believe there's going to be any impact from that? Or, sorry, that's...
I'm not sure, in all honesty. I mean, previous years I've seen a good immunisation, not, is it called immunisation? A vaccination strategy. I haven't yet seen it this year. I can get back to you on that though. Let me make a note. Yeah, thank you.
Councillor McLean.
Thank you. Anecdotally, we hear evidence that vaping is less troublesome and problematic in health terms than smoking, but we seem to be having perhaps more empirical evidence to suggest that might not be wholly the case. In encouraging people to stop smoking, which is a good thing, what are we doing about encouraging people to stop vaping, and in the case of younger people, to start at all?
Thank you for that question. I mean, a lot of you will know about the Tobacco and Vapes Bill, which is just going through Parliament at the moment, and that will have new restrictions on how vapes are sold, how they're marketed, availability of disposable vapes. I've been in discussion with Charlotte Pavitt, our Director of Public Health, about the strategy, and I'm aware that the Association of Directors of Public Health have written to the government with further recommendations on what should be done. I know that actually this is something that we're fully aware of, but actually it's the Public Protection Partnership that are the ones that are going to checking on places. I'm aware of them following up at a shop in Crowthorne that then got shut down for selling vapes to underage children. So there's definitely follow-up locally, and there's also a national initiative to make it less appealing and to put in stricter restrictions for children taking up vaping, and they're being followed up by the Public Protection Partnership.
Any more questions? Can't see any, and do we have anybody online? No. Okay, thank you. We can move into debate. Would anybody like to speak? You can speak once and for no longer than 5 minutes.
I would like to recommend that further thought be given to what the Director of Public Health, thank you very much, is actually going to do about encouraging people to stop vaping and not start vaping. I think that's something that would be quite valuable for the Commission to know more about.
Seconded, Councillor Watts. Yeah, I fully support that. Should we take a vote?
So that recommendation was for the Director of Public Health to provide further information about what they're going to do to stop people to start vaping and also to give up vaping.
Perfect, thank you very much. Any more? Well, thank you very much, Councillor Wright, for that update and for spending your evening here. And you're welcome to leave in your own time. We will move on to agenda item 8, which is the work programme update. And we're going to go first with Councillor Eggleston, I think, at the Health and Care panel.
Thank you. So just an update. We haven't had any further meetings for the JHOSC. At this moment in time, we believe we're going to have an update in October. So at this moment, there's nothing to report back on that. We've had meetings to discuss what future topics for the panel. So we're going to do a one and done review into health in all policies, and we're just waiting for a start date on that one. Then we're going to do a scoping work for review into the GP access review, and include into that sort of monitoring the NHS transformation. So we're sort of looking at that for summer next year, only because we're sort of, at this moment in time, we're sort of waiting for clarity on the ICB structures and hospital commissioning. So as it sort of stands at the moment, we'll be asking questions to people that they won't know the answers to. So we're just hanging on that at the moment. Then we met with Councillor Wright, and she went through the pharmacy review and discussed how there was a large disparity across the borough in numbers. For example, Crowthorne, under the new medicines, had something like 230 odd, whereas Bulbrook had over 1,000. So it was like, why is this happening? Can we
Is that
even this
1,000
out?
residents using the pharmacy?
Under the new medicines.
Right, yeah.
So she has sort of submitted her responses and recommendations to the team. So that's where we're up to at the moment. Thank you.
Thank you. Do you feel the JHOSC is serving a valuable purpose?
I think when at the moment, I think when it has been, when everyone's been told where it is, we can actually move on. Until the actual, because obviously it's commercially sensitive at the moment, it's very difficult to sort of sit and discuss anything, because until that, there might need to be changes if there's a change of location. But from October...
I can't remember when it was set up. It was May last year, wasn't it?
Yes.
Yeah.
Oh, yes. And we still haven't learned how to use the coffee machine over at Camberley. But there you go.
And still haven't got any closer to a location?
Yes, we have.
Right. Okay. Well, that's good news.
So when they came to see us, Frimley and the ICB, you remember that they made some really quite challenging commitments in that they were confident this thing was going to get built, recognising we're still running round in circles negotiating over a piece of land somewhere near Camberley, I suspect. No idea. No comment. We still have a defective model, which is looking at the throughput, which requires someone to fix social care first. When we get them back to sort of really go and ask these questions, do you think the JHOC is going to give you what and us what we need to challenge them? Because there's all sorts of things that are still wrong.
Yes, so hence that's why we're sort of linking in the review for the 10-year transformation, because all hospitals basically will be, whichever hospital it is, will just be doing the really sort of urgent people, most of the care will be in the community, and contracts will be going out to GPs in 2026 under what they want to do, whether they're going to stay as they are. But of course they want care in the community. So the whole idea is, under the 10-year transformation, you'll go into hospital and you will only be in hospital if you need to be in hospital. The rest of the care will be done in the community. So it'll be your outpatients, your social care. But at this moment in time, because we're not entirely sure on the ICB structure, that's why we can't ask too much via the officers at the council, because they don't know until that's decided. But in the meantime, the hospital will be built by 2030. So everyone, it will be, honestly. I'll buy you a coffee otherwise, Mike. But apart from that, that's why we sort of need to review how the GPs are going to do their part of it by keeping more people in the community, and how we're going to deal with the fact that more people are going to be in the community, and also the fact that we're going to have healthcare centres. And there's two types at the moment, one where you could have up to 50,000 patients and one where there's 250,000. Well, we don't really sort of tick those boxes for Bracknell. So that makes it slightly more difficult. And of course, where is it going to be? We don't have to build a new location, but it certainly needs to be decided. But contracts are going out in 2026 to doctors.
Councillor McLean.
Can I just make the observation that I think it's very important to be taking up seats around the table, and I can't think of two better representatives for Bracknell Forest to be keeping a weather eye on what the National Health Service locally is doing than Councillor Agus and Councillor Virgo, and I think it's very important for them to be there so that the local NHS trust appreciates that this is something of interest to our residents.
Yes, thank you, Councillor McLean. We are very determined, obviously, on the location, but it's not just that, it's the whole change to what we have been used to. And it's not just, it's great a new hospital is going to be built, but that's only just a small part of it. It's bringing so much more back into primary care. To stop it going into secondary care is going to be the real challenge for the PCNs and also the council as well. But we've got lack of clarity at the moment on that, just purely because the configuration of the ICBs at this moment.
Have we, as this commission, delegated the responsibility to you to attend that JHOSC and ask the questions, or will you share with us the questions you plan to ask before the October meeting so we can input? Or
Yeah, absolutely. What I try and do, I do sort of say we've got a meeting coming up. I always send around the minutes or give people a link so they can actually watch it. Sometimes, though, we don't see it until the actual day. The agenda, or if there's any slides. And, of course, you're sort of like just asking questions as they come along. But we're more than happy to take questions along. The last time we had a meeting, it was just a private meeting and that was it. So, of course, nothing could be shared that was discussed in that meeting. But, of course, I think as soon as it's announced, then we're actually talking about the building and the operational side of it, whereas we haven't been able to do that so far.
okay, that's clear. Thank you, Councillor Forster.
Is there the membership of the JHOST being treated with the respect and importance that we and the residents place on the importance of healthcare provision? Do you see what I mean? I'm listening. The agenda comes out on the day. Sometimes there's long distances, long time durations between meetings. Do you see what I mean? Are you being given the respect that you deserve and our residents entrusting us?
Yes, we are. I think, to be absolutely honest, we are obviously, there's only two of us due to the percentage-wise of how much our residents use it compared to Hampshire and also Surrey, where obviously there's 4 councillors from each of those. But yes, it's just when there's nothing to share, they don't share it until literally they've got something to let us know. And the chair obviously then lets us know there is a meeting. But it's sort of quite difficult because it's only about 19% of our residents that use that.
But they're not withholding.
The facility. No, but they can't withhold. Imagine holding anything from myself and Councillor Virgo. It's impossible. Seriously. No, but we are on top of it, and we always sort of check what's going on, and hence that's why we want to do a review on the transformation, just to ensure that we know what we're doing locally. It's up to obviously Public Health England, the government, to ensure what the hospitals are doing, because we haven't really got any say on that, but locally we need to know what our role is as a council.
Can you, you've just mentioned that 19%, can you remind us of that figure? So it's 19% of Frimley patients are from Bracknell Forest, but it's 90% of Bracknell Forest people use Frimley, or what is that percentage?
So I think as it stands at the moment, it's not necessarily the go-to hospital, because in an emergency, the Royal Berkshire is closer. And that's just the way it is at this moment in time. But for elected surgeries, I mean, don't forget, we've also got Heatherwood, which is fantastic.
And that's backed by stats, because Frimley's my go-to place for emergencies.
Yeah, absolutely. But as it stands at the moment, it will be, I mean, if anyone rings 111, it might be, they might turn around and say, they look at how, what the facilities are at that particular time and send you to wherever. We're hoping that there'll be obviously more facilities at Brants Bridge, because once again that will take off the pressure from Frimley and the Royal Berkshire. But of course that's all got to be discussed as yet. I mean, a lot of people are going to Heatherwood, and we're really pleased to say we have like 3 buses an hour that go to Heatherwood now for blood tests, etc., which frees up the GP's surgery time. So we'd encourage more people to sort of use that and to book that in. But also they'll have more elected surgeries there. You've got the diagnostic centre now that's open at Wexham, and Wexham's just had outstanding as their CQC review, which is absolutely fantastic. So it'd be looking at more what is around us and how we can use that and how our residents can get there, basically.
Certainly anecdotally, I know I'm spending a lot of time on this. In Binfield, we have the choice to, us women have our choice to have our babies at Frimley or Royal Berks. And sort of anecdotally from Facebook groups, the vast majority of women go to Frimley because the service is excellent, as I know from experience, absolutely fantastic. And that's such a key thing for residents in Binfield, certainly women in Binfield, to be able to continue to have their babies in that excellent facility. And
yeah, absolutely. I mean, it's an absolutely fantastic facility, but at the same time going on in the background, because there's all these national reorganisational, we've just got to find out if we're still going to be part of Frimley ICB.
I honestly don't think Royal Berks could take the surge of most of Binfield pregnant ladies if we lost that access to Frimley. Anyway, okay, thank you very much, Councillor Eggleston. Councillor Forster, Environment and Communities.
Mike. So we are kicking off the social housing review, and fundamentally it builds on the previous report that was done a few years ago. So have we completed all the recommendations? Are they being used? Are the recommendations being incorporated into our policies and practices? We are looking at the way that developers provide the current social and affordable housing to our residents. And broadly speaking, the key theme is how effective the overall solution that we have in this borough, how does it work? So it was a very interesting ABRI meeting today. I was online listening to them make the case on how they run their business. Must admit, it was quite interesting to understand the funding mechanisms that they have to call upon in order to deliver these houses, as well as their future targets. So actually, it'll be interesting to bring them into this environment to dig deeper into what they are proposing for our borough. I think it was 7,000 properties they said they had in the borough, which is an incredible number. Yeah. So the aim of the panel is dates in the diary for a whole series of modules, which will take us through till February. So we will have a really good deep dive into the effectiveness of affordable and social housing.
Councillor Eggleston.
Getting my own back now, Mike.
Getting your own back.
So my question is, so are you also covering the younger people with disabilities?
No, that's not in the scope.
That's not in this, because a lot of the problem that I know, like the council have, and when I was on the board at Silver Homes, was the fact that you had those with medical needs, but weren't sort of the age where they could, that you know, that they wouldn't go into sort of some sort of living accommodation because it just wasn't suitable. But they just needed it, so it had proper adaptations, like it was like ground floor, lower sink, that sort of thing. But it never sort of fitted in. And with bungalows, they build so few bungalows now that would obviously suit people, or they'd be looking for ground floor flats with adaptations. And that's one thing that it holds people up on the housing list at the council, the fact that somebody, we can't supply, just can't offer them those facilities, or our own team have to go in from occupational therapy and have to then do a lot of adaptations for them
Just
to get it
just on
livable.
that, I think, and as it's pointed out to me, we did sign off the scope specific for this some time ago. But your points are, you know, valid and from
It is.
knowledge.
So we are speaking as witnesses, residents. So the choice of resident hasn't been decided. So it could be that there are different segments that we might want to look at.
So you're saying you could incorporate some of what Councillor Eggleston's raising?
Because we haven't confirmed
okay.
the actual witnesses,
Yeah,
so who use the service yet. And
Well
that's
then,
part,
yeah,
part of the
that's-
journey.
Sorry,
Councillor
just to add to that this afternoon, if you remember, I think it was Sam that said that they were looking at the newer properties, and if there was a resident that had specific needs, they would adapt the new accommodation to meet them.
Yeah, I think it's going to be really interesting to get them here. I think having seen the Abri meeting this afternoon, I wonder if I've left it enough time, actually, because of the complexities of the services they deliver. So there's a bit of thinking around whether the module that they're in, we're going to have enough time. But I'll review that with the team.
Councillor Watts. Oh, you've got a question? Yes. Yeah.
Last one, I promise. So when you say looking at how effective the current housing system is, what do you mean by effective? Are we talking the ratio of people on the waiting list being reduced, the number of people being housed, or the appropriateness of the people matching the tenants?
So, there's a whole series of KPIs that we have. So it's how are we meeting our existing strategy and policy? That has to be the basis for where we start. I wouldn't want to come up with new KPIs and then say, well, you're missing them, you know, having never given them in the first place. So it's predicated on the effectiveness of the solution, and I mean all of its attributes that and all of its stakeholders, including ABRI, council officers, other parties today, in delivering what our residents need against the framework that we have in place.
Councillor Eggleston.
Sorry, just one other quick question. I'm really sorry. Is it just ABRI, or is it all the housing social providers that you're touching base with?
So there was a very good set of statistics which show the dominance of the various providers. So we are with Abri, you get, I think it's something like 3/4 of provision. And the others are then, I think there's 2 others which then cover, like, you're up to like 95%. Please don't quote, it's in that order. So at the very least, Abri, because you cover most people, and then if there's, as we design the witness programme, then it's whether we've got time to do that. But I would manage your expectations and suggest it potentially only Abri.
Right, shall we move on to the Education Skills and Growth panel? Thank you, Councillor Watts.
Thank you, Chair. So after a summer break, we are raring to go, with the next meeting being the 15th of September, with representatives from the ICB and Berkshire Healthcare. We have a survey to go to school representatives being sent out in the autumn term, and a desktop analysis meeting is being scheduled, and a review is now expected in December Commission due to summer breaks and the need for gathering more comprehensive data. Thank you.
What's a desktop analysis meeting?
Esther?
Just where the panel's going to look at comparisons of different websites and documents and best
like
practice
a
from other places. So
Computer desktop, right, okay. Okay, thank you. Any other questions? No, I know it's an important topic that we're all looking at, so look forward to hearing more. And on that note, agenda item 9, I promised the Commission to take some points and some questions that we wanted Peter Swallow, the MP for the area, to take to the take on in his work in Parliament. And I'm happy to update. I had a meeting with him, I think that week or the week after, to get the points across we wanted to get across. From his sort of response following our meeting, he then went into a meeting with the schools minister, and as part of which he was making the points that we had passed on, and he also spoke in the Westminster Hall debate on the 15th of July, raising again, the point that we're trying to make, the pressure we're trying to put on getting this school. His report back to me is he made the case very strongly that we need clarity to get on and deliver the local reform that we need. In terms of answering specific questions, we asked where Bracknell sat in the sort of priority list for the government, and the response back is there is no sort of queue or priority list. They're going scheme by scheme to work out actual needs and prioritise that way, but we don't sit in a queue as such. There was a firm no on whether we're missing out on funding because of SEND reports. But that shouldn't lead us to wait around on the important work that needs to be done, improving mainstream education, and the feedback on the safety valve point was that the Department of Education would be taking into account our local circumstances as they measure delivery against the safety valve. So read into that what we can. I'm very happy to sort of take further views, take further questions, keep this conversation going, keep pressure up through this group, and make sure that we're doing what we can, asking the right questions. So, Councillor Forster.
Just recognising, in fact, where you live, there'll be another MP. So both him and Josh Reynolds need to go and knock on the door together, just emphasising the 2 MP nature of our borough.
Yes, 2 is better than 1. Councillor McLean.
Would it be possible to have a copy of the response from the Member of Parliament, just so that if we all see it, we can then put our heads together and see if we want to take any further steps in relation to that?
Yes, if you're happy with my notes from the report I got back. Yes, yeah, for sure. Councillor Eggleston.
Is there a timeline that we're going to keep sort of saying, right, okay, we've had that response, we're going to go back to them again and see where they're at on it?
I haven't written it down from the discussion, but the autumn was mentioned. So I think now is the autumn, so we should keep going, I think. And I think it helps Peter make the case and, yeah, working together, and Joshua, as you mentioned. So no specific timeline. We can use this as an opportunity to work out what we want to do next. Or I can, as Councillor McCain suggested, I can circulate the points. You can have a collective think and we can regroup or discuss next steps. Any more? Okay. Well, if we don't have anything further on the agenda, so I think we thank everybody for attending, for a good meeting, and we can declare the meeting closed.